Namaste. We are indeed privileged to celebrate the Breastfeeding Week. Breastfeeding is not only important for the baby but also important for the mother. It is the best feed that the baby can have and the best feeling that the mother can have. It matters for both physical and mental health of the baby and also the mother. The advantages for the mother are many. It lowers the risk for iron deficiency, anemia, because it postpones the periods in the mother. It has an effective role in losing weight. It does prevent against breast cancer, ovarian cancer, etc. And also it lowers the risk for what we call as postpartum hemorrhage, that is bleeding after delivery. Breastfeeding within an hour of delivery is very, very important. Women should be geared up to breastfeed their babies starting from the first hour of birth to at least 18 months to 24 months. That reduces lot of metabolic problems in the mother like diabetes, hypertension, and also, as already mentioned, the cancer risks. For every year of breastfeeding, that is 12 months of breastfeeding, the breast cancer incidence reduces by 4.3%. And every mother per day will be spending around 500 calories. So the chances of obesity also comes down, which in turn reduces the risk for all these metabolic problems. So it is very important for the mother to breastfeed the baby for her own good also. And also the chance of depression will be much less in mothers who breastfeed. And it is an enjoyable thing for a mother to breastfeed the offspring. There are lots of myths about breastfeeding in India. Why is it so? Unwanted advice, unscientific advice, old customs despite modernization, nuclear families where there is lack of support and also lack of proper advice. Look good, that is feel good concept, especially in professional women. All these are barriers to breastfeeding in India. Many people have lots of myths regarding diet. They think they have to stick to bland diet, they should not be taking a lot of water, etc. And they say that they feel that the breast milk quality will be reduced if they had a lot of water. It's very unfortunate. If the mother is dehydrated, I don't think she can breastfeed properly, and she will be more prone for other serious problems like clots in the legs, lungs, brain, etc. if she is truly dehydrated. Okay, and they have this concept that they have to be the mother has to be fed with high ghee to improve the fat content of the milk, etc., which is all a myth. So it's important that women have enough water to drink, and that is 2 to 2.5 liters of water, and it is important to have a balanced diet. It is important to exercise adequately to keep the weight retention down, okay, after delivery. Clothing wise, there are lots of myths. Okay, they feel that warm clothing will increase the milk production, which is again a myth. Braziers can suppress the milk production, which is a bigger myth. So it's very important to keep oneself warm but not too warm, and the breast should be well supported. So a proper size brazier should be worn. And also women have this myth, oh, my milk might not be enough, baby is crying too much, I didn't have much milk with the previous pregnancy, I'm too old to get breast milk, etc., or feed. No, again, these are myths. The facts are, if the baby is wetting 5 to 6 nappies per day, that means that the baby is fed enough. Gaining enough weight is also another proof that the baby is feeding all right. And it can, I mean, well, my mother did not get milk, so I might not get milk. I mean, it is not a familial problem. Okay, breastfeeding, it's mainly in the mind. If one is more stressed about unwanted things, and also women who keep on wondering whether I'm feeding properly, etc., or which posture to feed, how to feed, if it's becoming a real stress in the mind, then probably the milk production will reduce. Okay, and also the feeding can vary from one baby to the other in the same mother. So the milk production obviously can vary. It can be spoiled if not fed for few hours, especially in working women, that's what they think. Well, milk can be refrigerated or frozen, can be stored in room temperature for 4 to 6 hours, and can be just warmed in a hot water bath. Okay, so there is a possibility that the milk can be stored and the baby can be fed when mother is away at work. Very important to know. And also positions, people wonder what position, how to feed, and it becomes a real circus. It need not be. Any position, sitting is better, lying down is better, need a comfy chair. All these are myths. Any position, encourage proper latching, that is all. Breast usually gets emptied in 10 to 15 minutes with a matured baby suckling. So the other this thing is the infections that the mothers might have, which might prevent breastfeeding. Well, we have heard people saying, I have cough, I have cold, I have fever, so I should not be breastfeeding. No, not really. Breastfeeding actually boosts the immunity of the baby, and also we should take necessary precautions. For example, if somebody is having cold, I think it's important that they wear a mask and feed the baby. Even with mastitis, you can still breastfeed. Okay, so it's important that you should not be missing out on breastfeeding unnecessarily. Lots of myths about breast anatomy. My breasts are small, I can't produce enough milk, have flat nipples, I can't feed. All these are some of the complaints that we get to know from the mothers. Milk production does not depend on the size of the breast, and also flat nipples, baby needs to latch the black portion of the breast, that is the areola, rather than biting on the nipples. So even if you had flat nipples, it shouldn't matter very much. So the other myth is, I can't get pregnant because I am breastfeeding. No, breastfeeding doesn't act as a definitive contraception. Okay, ovulation can happen as early as 21 days after delivery, and 2 in 100 can conceive even if the baby is fully breastfed. So it's very important to go for some contraception. So nursing mother needs to get good rest, let her sleep off at night is another myth. Okay. No, it is not the sleep, it is the stress which matters a lot for the establishment and continuation of lactation. So it is important that you enjoy breastfeeding and keep the stress down. Okay, there are many myths which cause a lot of stress, and I think it's very important that you keep the stress down. Okay, so on the whole, readiness for parenting is very, very important. Determination to breastfeed for 18 months to 2 years, which will give the baby the best. So if you want to have the best progeny, give it the best during pregnancy, during delivery, and also with breastfeeding. So with this, I would like to say it's very important for mothers to breastfeed, which has lot of benefits, not only for the mother but for the babies also. This year's slogan is, let's make breastfeeding and work. So it's very important for mothers to know about storage of breast milk, also baby friendly atmosphere in the workplaces is also important. Having a break from work, working from home, these are few things that we need to promote, because it's very important that the mothers give the best to their babies up to first 2 years of life at least. Thank you.
ರಾಷ್ಟ್ರೋತ್ಥಾನ ಆಸ್ಪತ್ರೆಯು 160 ಹಾಸಿಗೆಗಳ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಯ ಮಲ್ಟಿ ಸ್ಪೆಷಾಲಿಟಿ ಹಾಸ್ಪಿಟಲ್. ಅಂದರೆ ಒಂದೇ ಸೂರಿನಡಿ ಆಧುನಿಕ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿ, ಆಯುರ್ವೇದ, ಹೋಮಿಯೋಪತಿ, ಯೋಗ ಮತ್ತು ಪ್ರಕೃತಿ ಚಿಕಿತ್ಸೆಗಳನ್ನೊಳಗೊಂಡ ಸಮಗ್ರ ಚಿಕಿತ್ಸೆಗಳು ಇಲ್ಲಿ ಲಭ್ಯವಿವೆ. ಅತ್ಯಾಧುನಿಕ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ, ಉತ್ತಮ ತಂತ್ರಜ್ಞಾನ, ತಜ್ಞ ವೈದ್ಯರು ಹಾಗೂ ಇತರ ವೈದ್ಯಕೀಯ ಸಿಬ್ಬಂದಿಗಳನ್ನು ಈ ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. 19 ಜನರಲ್ ವಾರ್ಡ್ಗಳು, 72 ಸೆಮಿ ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳು, 11 ಎಮರ್ಜೆನ್ಸಿ ವಾರ್ಡ್ಗಳು ಹಾಗೂ 17 ಪ್ರೈವೇಟ್ ವಾರ್ಡ್ಗಳಿಂದ ಕೂಡಿದ ಸಮಗ್ರ ವೈದ್ಯಕೀಯ ಮೂಲಸೌಕರ್ಯ ಇಲ್ಲಿ ಲಭ್ಯವಿದೆ. ಮುಂದಿನ ದಿನಗಳಲ್ಲಿ ಬಡ ರೋಗಿಗಳ ಬೆಂಬಲಕ್ಕಾಗಿ ದಾನಿಗಳ ಸಹಾಯದಿಂದ ನಿಧಿಯೊಂದನ್ನು ಸ್ಥಾಪಿಸುವ ಗುರಿಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಜೊತೆಗೆ ಹತ್ತಿರದ ಸ್ಲಂಗಳಿಗೆ ಹಾಗೂ ಹಳ್ಳಿಗಳಿಗೆ ಹೋಗಿ ಉಚಿತ ಆರೋಗ್ಯ ಸೇವೆ ನೀಡುವ ಯೋಜನೆಯನ್ನು ಆಸ್ಪತ್ರೆಯು ಹೊಂದಿದೆ. ಆರೋಗ್ಯ ಸೇವೆಯನ್ನು ಅರಸಿ ಬಂದವರಿಗೆ ಮಾನವೀಯ ಮೌಲ್ಯಗಳೊಂದಿಗೆ ಆರೈಕೆ ನೀಡುವುದು ಮತ್ತು ಉತ್ಕೃಷ್ಟ ಗುಣಮಟ್ಟದ ಚಿಕಿತ್ಸೆ ನೀಡುವುದು ಆಸ್ಪತ್ರೆಯ ಆಶಯ. ಎಲ್ಲರೂ ರೋಗಗಳಿಂದ ಮುಕ್ತವಾಗಿ ಆರೋಗ್ಯವಂತ ಸಮಾಜ ನಿರ್ಮಾಣವಾಗಲಿ ಎನ್ನುವುದು ಆಸ್ಪತ್ರೆಯ ಉನ್ನತ ದೃಷ್ಟಿಕೋನ.